Hi, welcome to episode 10 of OSCE with Mudau ES. Today we will be doing oxygen therapy. Oxygen therapy is a procedure of administering oxygen to the patient at a higher concentration than that in the atmospheric air, with the intention of promoting and managing adequate ventilation and oxygenation of the blood tissues. Similar with all procedures, we must start by washing our hands with soap and warm water. This is to make sure that we prevent cross-infection as in accordance with infection control policies. Once your hands are clean and free from infection, continue to the patient and do your greetings. Introduce yourself to the patient as in accordance with the patient's right charter that states that every patient has a right to be nursed by a well-identified personnel. Once you are done identifying yourself according to the protocol, thereafter introduce your assessors again. As part of giving information to the patient, explain thoroughly the procedure that you want to do to the patient. Immediately when done, ask for consent if you may continue or not. Once you get consent from the patient, make sure that you assess the immediate environment of the patient, to check the cleanliness of the environment, to check if the windows are opened for good ventilation, to check if there are no sharps on the bed, even on the floor, to avoid medical legal hazards, to check if the bed breaks are put on and functional to avoid patient falls. And when done, also check the patient's need if the patient needs anything before you start with the procedure. Hospital policies requires patients to be identified from admission up until discharge with a white identity belt where you will write the patient's name, the patient's hospital registration number, and the unit number where the patient is going to. Immediately when you are done with identifying the patient, which is a critical point, make sure that you check the prescription inside the patient's file. Do not forget to assess the patient's condition. Check the breathing pattern. Check the signs of cyanosis on the patient. Check the vital signs, which includes pulse, respiration, and blood pressure, as this may determine the oxygen in the blood of the patient. During your planning phase, these are the items that you need to collect: oxygen point, which is functional, a flow meter to be connected on the oxygen point, oxygen tubing, humidifier bottle with water, oxygen mask as per in the prescription, the nasal cannula also as in the prescription, and the no smoking sign. Decontaminate your hands before you proceed with the procedure as guided by the World Health Organization, which is WHO, on the 5 moments of hand wash, which states that you should wash your hands before doing any procedure and after being in contact with the patient's surrounding. As part of a critical point, connect the flow meter to the oxygen point and turn it on to see if it's working. Connect the humidifier bottle with water on the flow meter. Continue to connect the oxygen tubing line on the humidifier bottle. In addition, take the prescribed mask or nasal cannula and connect at the end of the oxygen tubing and open to see if there's oxygen coming through the mask or the nasal cannula. Once you see everything that is functional, regulate your oxygen to the prescribed volume as per in the prescription in the patient's file. When applying a face mask as prescribed, make sure to start by positioning the patient in a semi-Fowler's position to allow airflow. Place the mask to cover both the mouth and the nose of the patient to allow that there will be air coming out from the mask and make sure that it's tight. Secure the mask around the head with the string which is connected on the mask. If you are using a nasal cannula, the same applies. Position your patient in a semi-fowler's position to allow airflow. Put the outlet prongs into the nasal passage, making sure that the prongs are facing upside. Secure around ears and head to allow enough air. Once everything is done, give health education to the patient about the oxygen therapy in totality. To avoid cross-infection by another patient using the same mask that your patient will be using, make sure that you label your mask accordingly by including the patient's name, registration number, and date the mask was applied. Make sure that the patient is still comfortable. Continue to give health education if necessary, and make sure that the patient's needs are met before you finish up. Once done with the procedure, make sure that you decontaminate your hands as part of infection control policy of your hospital. Evaluate the oxygen saturation and vital signs. This you do to monitor the patient's progress since you've applied the oxygen therapy as explained, and also check on the patient's comfortability. Following the principles of record keeping, make sure that you use a black pen, you write your date, time, and your signature at the end. Indicate everything that you've done on the patient, and also report everything that you've done if there's any abnormality to report.